We were really excited about those early indications in the pilot, and obviously qualitative feedback was really important. But what does that mean from a longevity perspective? How do we look at these outcomes and ensure that we're building ourselves to properly evaluate at the end? So looking at trial for outcomes, looking at that recovery and return to work rates in a really logical way. So we built out this trial, and it was a 2-year trial. So we looked at multi-year, and we had to look at thousands of claims. Really importantly, we were looking at a randomized control trial. So we had control that were not getting access to Perx, and it was a prospective design. So we were really unique, and we feel very robust in terms of proving out the value of what Perx was doing in this cohort. We made sure we collaborated with understanding what does WorkSafe evaluate. So at the end of the trial, they had a very clear understanding, in line with potentially other pilots they were running, what was Perx doing.
There's really two parts to this that we were very mindful of. We wanted to be able to see probably the return on investment and the financial outcomes, but we also wanted to understand the experience of our end users and our injured workers. And I think a few people in the room, as Fiona said, would probably be sitting there going, would this work for us? Would this work in our jurisdiction? Would this work in our scheme? And I think, I think what we sort of found is being really clear around what evaluation, what success looks like. So I think it's really important to make sure that they are very clear up front. And then if you then are able to do that, bring people on the journey with you, then it makes it a lot easier at the end when you're really sort of saying, okay, we really want to invest and roll this out as a BAU product.